All right, let's work through this one here.
Starting with the question, which of the following is most likely elevated? And looking at our answer choices, would be probably a heme question. We have a pregnant woman at 28 weeks gestation, concerned about her baby's development. She has been experiencing fatigue, pallor, frequent headaches. Physical exam shows a slightly enlarged liver and spleen. We do have macrocytic anemia and hypersegmented neutrophils. So that already pretty much narrows it down to probably being due to B12 or B9. So asking you which are usually deficient. So we can cross those out because those are usually, it's asking about what's actually elevated.
Okay,
So
which one does you want to cross out?
I want to cross out folic acid, B12, and B6. So then we have to figure out if the problem is a deficiency in folic acid or in B12. Because she's pregnant, folate is usually a big issue. So it's probably a folic acid deficiency, which means that we're going to have elevated, I can remember which one's which. I think it was homocysteine.
Okay.
I think methylmalonic acid is B12.
Okay, final answer.
Final answer.
Okay, perfect. So let's talk about kind of how you work through this. I think you worked through it beautifully. Okay.
Thanks.
So first thing, right? Reading the question first, always great. Got to do that. Step one, I always say read the question first. Step two, kind of glance over the answer choices. So you narrow it down to biochemistry, which is kind of the topic we're dealing with. And then as you read, then you can get even more specific, right? You have a 24-year-old pregnant woman, right? You use that to your advantage later on, right? You said that she's pregnant, and so likely you're dealing with folate issues, right? Fatigue, pallor, frequent headaches, right? She has a slightly enlarged liver and spleen, and then macrocytic anemia, right? So you have a deficiency usually in B12 or folate, right? And hypersegmented neutrophils, also dealing with kind of missing folate or B12. So those lab values are not giving you too much, right? But one of the key things clinically that you have to think of here, because a lot of students will probably look at this and like, how can you tell if it's folate or B12? But remember, B12 storages, how long does it take to deplete B12? Do you remember?
I want to say it's like 5 years. It's a
Yeah,
long
it's
time.
long time, 3 to 5 years, right? Of malnutrition, right? Whether you're not eating enough supplementation, right? Or vitamins, right? It takes 3 to 5 years if, like either you're vegan or whatnot, and you're just not eating enough nutrition, getting B12 in your diet. You have to be vegan for 3 to 5 years for it to completely deplete. So in this question, right, if you can use multiple kind of logics here. One, right, no pregnant women need to take folate for prenatal vitamins, right? So if you kind of connect those dots, and you know that likely the reason why we give pregnant women folic acid because they're missing folic acid. Or the second kind of logic you can use is the fact that, oh, B12 storages shouldn't be depleted in 28 weeks, right? So
Yeah.
either one would work. But then you get it down to two. It's always the dreaded two, homocysteine or methylmalonic acid. And as you kind of said, right, methylmalonic acid is going to be decreased, right? But remember, it's going to actually be decreased in both. So if that's another
Yes.
kind of logic that you can remember too. And if you knew it was folate, then you can pretty much guarantee your answer because you're covering two answer choices with homocysteine, right? But I think you made you have to know the other flip side of the coin, because they're going to ask you more about methylmalonic acid, right? Which is only elevated in vitamin B12, but not elevated in folic acid, which is super, super important to differentiate the two. Do you have any questions about this? Yeah, I think you did a great job. And I think a lot of people would have missed this question, because if you're not tying it in clinically and you're trying to remember buzzwords, you're going to have a really difficult time answering this question correctly.
Yeah. Yeah. I agree with that. When I used to just focus on the buzzwords, I would have gotten stuck for sure.
Yeah, for sure. You just kind of go down this rabbit hole and you're just like, okay, well, where's the buzzword to differentiate between folic acid and B12 deficiency? And you'd be stuck here because there's not much that they're giving you, right? They're trying to, on this question, they're trying to make sure that you understand the clinical version too.